This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2018. Prescription opioid use is epidemic in the U.S., and a recent report showed that preoperative opioid use is associated with increased healthcare utilization and poorer outcomes following abdominal surgeries. Given the high prevalence of opioid use in the U.S., it is essential to evaluate the impact of preoperative opioid use on postoperative outcomes of common orthopedic procedures, such as total hip arthroplasties, THA, and total knee arthroplasties, TKA, which account for greater than 1 million procedures performed annually. Researchers at the University of Chicago used 2 national claims databases to investigate a large, diverse sample of patients who underwent a primary THA or TKA between 2003 and 2014. Associations between the patient's preoperative opioid use, postoperative 30-day readmission, and requirement of revision surgery within 1 and 3 years post-surgery were examined. Over 50% of the study population had at least one opioid prescription filled preoperatively, while nearly 20% used preoperative opioids for more than 60 days. Significantly higher rates of 30-day readmission were observed after THA or TKA for patients with more than 60 days preoperative opioid use than for those with no preoperative opioid use. Similarly, patients with no preoperative opioid use had lower revision rates than those with more than 60 days of preoperative opioid use. Both these trends persisted even after adjusting for age, sex, and comorbidities. Thus, this study demonstrates that prolonged preoperative opioid use increases the risk of poor early outcomes such as hospital readmission and revision surgeries in patients after THA or TKA procedures.